Good evening, everyone. My name is Prosper, like you all know. So, in the past couple of days, my friends, the May friends, they've been messaging me, telling me about why I have not dropped content and why is it that all my content are about women. That do I have anything against the guys? So, because of that, today I want to talk about a problem that affects men generally, and that topic is premature ejaculation, also known as quick ejaculation. So, let's get right into it. What is quick ejaculation? What is premature ejaculation? It is when you ejaculate earlier than planned. When you ejaculate during foul play, before the actual sexual activity, just foul play with your partner, you've already ejaculated. When you just get aroused, you've already ejaculated, or when you just start sexual activities, you just ejaculate. All these things are termed weak ejaculation. But I want to bring it to your notice that it's not a problem that you say you are finished for life. No, because as a guy, let me just tell it to you that at every point in time for a guy's life, they must have experienced this particular problem. Every guy out there at the very particular point in time during their sexual life have experienced premature ejaculation. So it's not a problem, it's not the end of the life, it's not a bad thing. Don't feel ashamed for it, don't feel bad for it. So today the major focus is we are going to be looking at major causes of this thing and possibly the effect, what it brings, what it causes. You understand? So what are the things that bring about this quick ejaculation? What are those things? So I'll be giving you varieties of factors that causes this thing. Number one is what we call psychological aspect of it. Psychological causes. We have depression. All right, when you are depressed, we have anxiety. Something is bothering you. You're just so anxious about something. You are anxious about having sex. You're anxious about doing it with somebody. That alone can cause you to release or ejaculate before time. Then we have relationship problem. When your partner is nagging all the time, your partner is complaining about something all the time, or something is bothering you in the relationship, all these things bring about it. Then we have another factor. We have neurological factors. That is your brain activities. Neurological factors. We have nerve damages. When some of the nerve that send information are damaged or misfunctioning. Because information passes. We have motor neurons, sensory neurons that send informations to the different part of the body. Okay, so every part of the body have sensitive receptors that receive information. Then your brain interprets it and sends it back. I know I'm speaking big grammar, but I will have to break it. The moment you touch a female or a female touches you, your information is sent to your brain and your brain interprets it. So when this interpretation is wrong, the brain will interpret even ordinary pain can be interpreted as pleasure, therefore causing you to release on time. Alright, so that is that. Then we have what we call multiple sclerosis. I don't want to speak about that, I will not confuse you, but we have multiple sclerosis. Then we also have other factors that also cause this thing. We have physical factors. We have like prostate problem. When somebody have a prostate problem, it can be prostate cancer, prostate malfunction. Then it can be urinary tract infection, when the urethra where urine passes through, when it has a problem. A man, the penis have a urethra where urine passes through. When there's a problem in it, it can also causes a man to release or ejaculate on time. Do you understand what I'm saying now? So that is that. So like I said, we have urinary tract infection, we have prostate problem, all these ones are physical. Then we also have other problems like drug use. Those people that use drugs, you understand? People that smoke. Then we talk about alcohol. All these things causes it. Then we also talk about hormonal imbalance. So when you have hormonal problem, especially imbalance in your serotonin is a good hormone that also helps in this secretion and increasing your sexual urge. Then we also have testosterone problem. Testosterone is a secondary sexual character hormone for male to stimulate release of sperm. So those are the hormonal problems. So all these things I just said are what causes this. So if you are having quick ejaculation, it means that one of these things I've just said is part of what is causing it. Either it might be neurological, it can be psychological, it can be physical, it can be hormonal. Any of these things can cause it. So all you have to do is understand what is bringing it before you can now look for the solution. Then what are the effects? This thing can bring about lack of self-esteem, lack of sexual intimacy. When your wife touches you like this, you become angry. You just go to the parlor. You are not feeling it because you know you cannot do anything. You understand? And then you have low self-esteem. Then you have suicidal thoughts. You want to then you have this low self of belonging. When your fellow colleagues are talking about their sexual prowess, the sexual powers, you don't engage in such topic because of your lack of inability to satisfy. Then you have family problem. It can bring a discomfort, a problem between you and your partner. You understand? It brings a lot of problem. It can lead to divorce and all that. So what are the ways you breach these things? Okay, one, like I said, the factors are so numerous. First, you have to understand the particular factor that is affecting you. So if it is psychological factor, like I said, anxiety and stress. So for you, before you go into sexual activities, you have to first of all let go of the things that is bothering you. You have to first of all let go of the things that you are thinking. You have to first of all let go of the fact that you want to have sex. You want to engage in sexual act. You just have to first of all take it as an activity, that you want to engage in an activity. And then there are other practices that we normally use to encourage people to do. Sometimes it is advisable you go for sex therapy, or you visit your doctor, depending on the cause. Unless you have known the cause of the problem, that is when all those things can come in. So I am going to try as much as I can to try and give you different options for each of these causes that I said. So if it is for some people now, like I said, alcohol, drugs and smoke, some people, these are what stimulate them to last long in sex, while some people, these are what inhibit them to release on time or to have premature ejaculation. So if you are the type that is engaging in too much smoke, reduce it. Too much alcohol, reduce it. If you are abusing a particular drug, reduce it. Okay, it will help. Then if you are the type that is always stressed from work and all that, what you normally do in such case is engage in conversation with your partner. Before anything, tell your partner how you feel. What are your fears? What are your problems? Tell her that you are afraid that you will not be able to satisfy her. Tell her that you don't know how long you will go. Discuss it with her, and then before then she will know how to prepare you. Just mere discussion alone prepares your mindset for the sexual activity. So but then I like to stop here. I will get another video explaining further on it. So but please like this video, comment, share to your friends, okay, and subscribe to my YouTube channel, my Facebook page, and follow me on Instagram and my TikTok account. God bless. Expect my next video. I like you to go to the comment section and show your interest. That will enable me to release the next video concerning the topic we have seen. Alright, good night. I remain your humble point one teacher, Mr. Prosper.